There's about a 50% overlap between eating disorders and substance abuse, and hardly anything when it comes to levels of care, full spectrum care that can treat both at the same time. All of the patients over the years that have been, I won't say mistreated, but not adequately taken care of, with very serious outcomes up to including death, because they bounce back and forth between the substance abuse treatment center and then the eating disorder center, and the whole time their suicidality is not treated. It's been very personal to me as a person in recovery from addiction, as well as an eating disorder, as well as a bunch of other stuff, who, by the grace of God, got into the right hands treatment-wise and was able to not only stay alive, but have a really full and wonderful life, including SunCloud Health and the blessing it is to show up to work every day and be able to help people and be of service. It's always made perfect sense to me that we would treat all of the different diseases that are active. And I think part of it is, a training issue, like I said before, knowing what you don't know. A very extreme example, if somebody came to me with rheumatoid arthritis, I'm not going to be the person to treat the rheumatoid arthritis. I don't know the latest on medications for it. I know only a very little bit. I don't know what to look for, what tests to order. And it's similar in the mental health field when you talk about specialty areas like eating disorders and addiction. So commonly, patients are going to providers not knowing fully themselves that they have an addiction. And if they go to a provider that has no addiction expertise, unless it's an extreme addiction, it's not going to be identified. And what they're actually thinking they're going to the provider for isn't really going to get healed, because we know that addiction and depression play off of each other. We know that people don't really heal from PTSD if they're actively using a substance or in the grips of an addictive behavior, like an eating disorder or a food addiction.